Hi, everyone. On behalf of the Office of Recovery, my name is Micah Joslow, and I'm excited to welcome you to today's webinar on the USDA Distance Learning and Telemedicine Grants Program. The USDA DLT program is a long-running program centered around connecting rural communities to distance learning and telemedicine opportunities. These have, of course, become increasingly relevant with the onset of the pandemic. Over the course of today's session, we plan to do a number of different things. First off, we want to describe the USDA DLT program as a whole before defining clear action items for next steps that you can take to prepare to apply for federal funding. And then finally, we plan to clarify additional support available through the Recovery Office, the Office of Broadband Development, and the USDA to support with this process. Before we get started, I have a number of hosts that I'd like to introduce you to. To start off, I'm going to introduce you to Stanley Adams, the Director of the Kansas Office of Broadband Development. Stanley, thank you so much for being here with us today.
Stanley, I think we might have you muted.
The phrase of 2020. Sorry about that. Thanks, Kelsey. Thank you all for visiting today. Even I'm prone to the muted mistake, but really do appreciate the opportunity to partner with the USDA as we have in the past and present some information that I think is uniquely helpful, particularly in terms of telehealth and distance learning. Office of Broadband Development is committed to improving broadband throughout our state, and this is just one of those ways that we try to make sure that we're doing our part to further those opportunities.
Thank you so much for being with us today, Stan. Next up, I'd like to introduce you all to Roger Meeks, who is a field representative for the state of Kansas to the USDA. Unfortunately, it seems like Roger's audio isn't currently functioning, so we're going to come back to him in a moment. Before we hear from Roger, we're going to hear from Kelsey Olson, who is the Deputy Secretary of the Kansas Department of Agriculture.
Good afternoon. I just wanted to welcome everyone, and certainly broadband is a critical component to the infrastructure and a lot of the future success in agriculture. When it comes to distance learning and telemedicine, those are critical components of any rural community. So from the Department of Agriculture, where we are supportive of this and look forward to the potential growth and impact that these dollars can have in our rural communities.
Thank you so much, Kelsey. Up next, we're going to hear from Josh McGinn, who is a policy analyst for the Kansas Office of Rural Prosperity.
Thank you, Micah. Can you hear me okay? All right. Well, thank you all for attending this. I just wanted to say, with all the work that the Kelly administration has done to expand access to broadband during the pandemic and partnership with led by the Office of Broadband Development and in partnership with Department of Commerce, Department of Agriculture, the legislature, the Recovery Office. We really appreciate this opportunity. And as the state works with local communities and providers to ensure that broadband access exists throughout the state, it's very important to continue to take advantage of opportunities like this to take that infrastructure expansion one step further. As everyone knows, during the pandemic, broadband got a lot of attention, but we had heard about this as a concern since the beginning of the administration, and that's why before the pandemic, they put money in place to fund the first broadband grant program in Kansas. And so we just, again, appreciate any opportunity like this and definitely want Kansans to be able to take full advantage of it wherever they choose to live. Thanks, Micah.
Thanks so much, Josh. And I believe we now have Roger's audio working. Roger, can you join us as well?
Yeah, Micah, can you hear me?
Yes, we can hear you now. Thank you so much.
Great. Sorry for the technical difficulty there. Just very excited to be on the call. Look forward to the questions we're going to get in reference to the distance learning program. The funding opportunity announcement for the program is open now until June the 4th. So hopefully get a good dialogue going, and everybody is excited about applying for the program and has a lot of questions. Thank you.
Thank you so much, Roger. And finally, last but certainly not least, I'm going to introduce you all to Jen Corian, who is an MD. She is a consultant at Witt O'Brien's and is going to be our host for today in terms of the technical aspects of the USDA DLT program.
Thank you, Micah. I think that we're all really excited about this upcoming opportunity. And as Roger just mentioned, the deadline for the application is June 4th, and the funding opportunity is online. I'm just going to go over the basic logistics of the grant on the next slide. Okay, so the USDA put $44.5 million towards the distance learning and telemedicine grant. The goal of the program is to help rural communities use telecommunications to connect to rural areas, overcoming the effects of being in remote locations and having low population density. In order to be eligible for this program, we will go over the eligibility, but it's for rural communities, and the cost, and it supports the costs associated with capital assets, instructional programming, and technical assistance. The range of the grants will be between $50,000 and $1 million, and there's a minimum match of 15% that's required for grant-only awards. I'm going to ask Stan to go over the eligible applicants for this program.
So just in brief, the distance learning and telehealth grants are, there are some unique qualifications for who can apply. And as you see here, first and foremost, it needs to be for, didn't have my own video on, for populations of 20,000 or less. So this is meant for a smaller population areas. But within that, any applicants can be any of those who are provide educational healthcare related services through telecommunications. And that includes, as you see here, most state and local governments or entities, federally recognized tribes. We have 4 of those here in the state, for-profit, non-profit, and consortia are eligible entities. This is very, by the way, consistent with how we in our office try to frame up our funding opportunities as well, is to cast a wider net instead of a more narrow net. The key is to demonstrate that you've got the expertise and ability. So I think that's one of the attractive things. Although it's a little bit targeted specifically, which makes this unique, is that it's for those smaller populations, which is a particular focus for the USDA. And that's it at the high level, who's eligible. Let me turn it back over to Jen. I believe I'm turning it back over to you now, right?
Yes, actually, I'm going to, now that we have Roger with us and he is more well-versed with this program, I'm going to ask him to go over the eligible expenditures and the capital assets and long-term support on the next slide.
Yeah, Jen, thank you very much. And hopefully everybody can hear me now. The one thing I did want to go through, the capital assets that are eligible are basically those eligible assets that would be to provide distance learning and our telemedicine. You can see some of the examples here. It could also be bridges, It could be also computer hardware, inside wiring inside the building. About a year ago, we did allow up to 20% of the funds could be used to bring the conductivity into the building where the distance learning and or the telemedicine is being provided. Keep in mind that once that happened, the eligible applicant or the applicant in that case would have to continue to own either the fiber or if it was a small microwave unit or whatever they were using to connect that building. The one thing to keep in mind that would not be eligible is anything of an operational type expenditure. So for example, even though we would bring in the fiber or a microwave unit to the building itself, we wouldn't pay for the recurring cost as part of the grant for that. So that's one, or any salaries in reference to the people providing this as well. So with that, that's kind of a 30,000 foot level from what we can and cannot fund with the distance learning and telemedicine program. Keep in mind with the equipment that, say, for example, roughly the rule is if the piece of equipment is being used 51% and above, it would likely be eligible for the program to be funded under it. If it's anything that would be of a consumable nature, for example, those would be treated as an operational item. It would not be eligible for use in the program. So a lot of times computers, cameras, microphones, laptops are being used, Zoom licensing, a lot of those things. And then in telemedicine, it could be any type of equipment that would be used to provide telemedicine as well. So I'll turn it back over to Mike.
Thank you, Roger. So I appreciate Roger for explaining all the eligible expenditures. I know he touched on the fact that salaries and other operational costs will not be included. And that includes things like benefits, evaluation costs, and other indirect costs. I know Stan touched on who's eligible from an organizational standpoint. I would like to also include that in order to be eligible, the services need to be interactive, meaning like real-time distance learning and telehealth projects that benefit the end users in rural communities, which leads us to the scoring piece of this project. Can we go to the next slide? Okay, so there are different components for the scoring piece of this project. We'll start with the rurality. And this is calculated for each end user site, and the score is based on the census population data. So the highest points here, which is 40 for this category, will be given to the most rural sites. So for example, if the end site is located in an area with 5,000 people or less, you'll get the highest number of points. And if the end site has 5,000 to 10,000 people, then it will be 30 points and so on. So there is a slide at the end of this presentation that goes into a little bit more detail so that you know what to expect in terms of the scoring. The next piece is the economic score, and this is based off of the poverty data from the Census Bureau's Small Area Income and Poverty Estimate Program. Previously, the economic need was calculated based on the average of end user sites taken from this website. It's recently changed to calculate an average based on the score of each individual end user site. The next piece is the special considerations, which can be from 10 to 20 points. So the special consideration is something that has changed for this round. The RUS is now offering special consideration points to applications that have a primary purpose of opioid or other substance use disorder treatments, or that serve tribal lands. I believe that the programs are geared towards treatment and prevention of substance use. I think those programs are worth 10 points, and tribal communities, if you're serving tribal communities, it's worth 20. I think that Roger might be able to expand on this a little bit better. Roger,
Yeah, thanks, Jim.
yeah, no problem.
Yeah, thank you. The opioid or substance abuse disorder points would be 10 points this year. In the past, they gave 10 points for STEM, as well as if the application was located logistically within an opportunity zone. Those would no longer be awarded for special consideration points this year of 10 points. But the opioid or substance abuse disorder would receive 10 points. And to keep in mind, it would have to directly be involved with the opioid or substance abuse treatment. Eligible purposes kind of include like counseling, could be treatment, could be training of medical professionals and either counselors or responders in reaction to or treatment of substance abuse disorders. And then also the education programs addressing substance abuse or opioids abuse as well. Now on the 20 points for the tribal lands, that is for those tribal nations that are federally recognized. And if there's questions later on in reference to that list, I can direct everyone to where that is in the federally recognized areas of the country is listed within the application guide itself. So with that, I'll turn it back over to Jen. Thank you.
Thank you, Roger. I appreciate that. And then for the subjective criteria, this scoring addresses the need for services and the benefit of the project. So when addressing the need for services, it's important to highlight economic, geographic, educational, or healthcare challenges with supporting documentation, which means that there need to be some metrics included in the application. So one thing to consider as you apply is to quantify the benefits of the project you're proposing. So I know one thing Roger mentioned earlier in one of our conversations is that they're looking for new and innovative projects. And I think that that will weigh on the score, if I'm not mistaken. So think of ways that you can document the benefit and the expected outcomes of your project that you're proposing. We can go on to the next slide. Okay, so for those of you who have applied for this grant before or are familiar with telemedicine and distance learning, please bear with me as I review these concepts related to the way these projects are structured. So there are hubs and there are end users. So when the structure is from hubs to end users, the content or service provider connecting to end users end user sites will receive content or services. So for example, this would be like a medical center that has a specialist connecting with a smaller hospital or clinic without a local specialist. Whereas a hub end user to hub end user site is sites that provide experts to share content or services connecting to remote sites. Who will receive the content and services and deliver back different content or services. So an example of this would be like a rural high school with a Mandarin teacher connecting with another rural high school with a Spanish teacher. Students at both sites will receive foreign languages that are not locally available. Another example would be a rural hospital to a rural mental health and substance use disorder clinic. And I have a few other examples that I could share. Like, for example, like I know we went over from school to school, like I know school to health center, that's another hub to hub for education for prevention and wellness, mental health, and other substance use disorder programs. So I encourage you to think outside the box when you're creating different types of, thinking of the different ways you can structure these projects. Okay, we can go on to the next slide. There we go. Okay, so for this round, there were a few changes that you should note. If you are, especially if you're familiar with the previous rounds of funding, along with these changes that are mentioned here, you should know that only one application per applicant will be approved. If you submit multiple applications, they will pick the highest scored application. Awards can no longer be transferred to other entities. And as mentioned earlier, the economic need scoring has been changed to calculate the average economic need based on the score of each end user site instead of assigning a score based on the average. As noted here, there's no longer consideration for STEM programs. I know Roger also mentioned that earlier, and no longer consideration for opportunity zones. However, points may now be awarded for services provided to tribal lands. Another thing that I encourage you to include in your executive summary as you write these applications is the impact on your organization related to COVID-19. I think that that's very relevant to what we're experiencing now. And I think it will help the grantor understand what your organization is trying to accomplish and what your organization has experienced. So we can go on to the next slide. So as you prepare to start applying, the first thing that you need to do is to take steps to obtain your DUNS number and your CAGE code. These numbers will be used to identify the applicants in the government systems. And also, if you haven't already, register with the System for Award Management and grants.gov, where you'll be applying to receive the DLT funding. I also highly encourage you to reach out to Roger if you have any questions about your application. I would also note that he can answer questions by phone or by email anytime except for 15 days before the application, which means that he will not be able to answer anything, I think around May 20th, if I'm not mistaken. After that, he won't be able to help, but I would take advantage of him as a big resource before that. Go on to the next slide. So I do have a medical background, but the bulk of my experience is in grants work. So I know that this application can look daunting, but I would highly encourage that as you go through, there are multiple worksheets which are just basically inputting your organization's information. And as you think through the need for your community and the idea that you're proposing, I think that the narrative will be a little bit easier to formulate. They have very clear guidelines. There's a great application guide that's available through the USDA website. The application portal is very straightforward for those of you who have not applied for this grant previously or have never used grants.gov. And the reporting templates are standard. So from here, I would like to invite Stan to talk about the support that we're hoping to offer you going forward. Stan?
Oh, I gotta go. I'm sorry, Jen, multitasking here.
That's okay.
So in terms of follow-up, you see here how to reach out to us for KDC _broadband at ks.gov. You were asked, I'm sorry, Jen.
That's okay. And so along with reaching out to the broadband office, you can also reach, there's Roger's contact information is here. And there is also another website, Kansas COVID support at ks.gov for more detailed questions. Now that the application process has already started, we're hoping to offer more webinars throughout the grant process in regards to the application process and the progress reporting and closeout and things like that. So we're really looking forward to work with you to help you receive funding and to successfully implement your projects. So with that, I will turn it back over to Micah.
Thank you all. So what we're going to start with now is questions and answers. I know that we've had a number of questions already in the chat, the first of which was regarding whether or not we would be sharing these materials after the fact. Through the same distribution list that you all learned about these materials, we will be sharing the actual materials themselves. The first question from a content standpoint that I can find is from Janet, who asks, is the population based on the applicant? So a city or school or district should be 20,000 or less. Jenna, Roger, would you be able to address that?
Yeah, this is Roger. The score is going to be based on the reality of the end user site. And basically the smaller, the better. I mean, 5,000 down, you're going to probably pretty much max out all your points. Once the end user site gets to 20,000, you would get 0 points. So hopefully that answers your question. And I'll get my contact information on here as well. The one thing that I did want to mention to everyone, and this just came out, there is going to be a national webinar in reference to the program on both the 14th and the 20th of this month. And I'll get that information to Micah. So Micah, can you send that to all the participants? Would you have a record of those?
Yes, we're going to make sure that all of the different individuals who sent out the invitation will share that as well.
Okay, great.
Perfect.
And I will get my contact information to everyone as well.
Perfect. Thank you for that, Roger. And your email is included in the materials that will be circulating after the event. Our next question comes from Brandon, who asked, would increasing our fiber optics in our downtown district or lakes qualify?
That's not the primary purpose for this program. If this program is primarily for those needs for distance learning and or telemedicine and equipment associated with that, up to 20% of these funds can be used to bring conductivity to the building. Again, as long as the applicant, whoever that may be, would continue to own those. The better programs would be through USDA and others. Through USDA, we have an infrastructure loan program for those incumbent carriers or those ISPs. And then we also, the Reconnect program is currently probably going to be announced, the funding opportunity announcement in either late fall or early winter of calendar year 2021. And then also there's the Community Connect program. It just closed, and it's a grant program up to $3 million that could help areas. But if you have questions in reference to those needs, please feel free to contact me.
Thank you, Roger. Our next question comes from Jason with a related question. They asked for some specific examples of the equipment that will be eligible for funding.
Yeah, as far as the type of equipment, if you keep in mind on a traditional distance learning, it could be TVs, it could be bridges to connect everyone. It could be like Zoom licensing and other type of licensing for applications. It could be computers, again, microphones in the room, electric wiring inside the building that the distance learning or telemedicine was being provided. And it seems to be more of an issue maybe on telemedicine, because there's so many applications you can add on to the system to provide telemedicine, but it's anything that would be used 51% and above to provide telemedicine or distance learning. Furniture usually is not going to be funded with this at all, like tables and chairs and those type of things, or pods, but maybe like the main, like if you have one room that's set up for distance learning, that main console will be eligible. But just keep in mind, it'd probably be, the main thing a lot of times is cameras, microphones, big TV type screens or different screen associations for a room. With more the remote nature of everything that's going on with COVID, we've seen a lot of different laptop type applications where they're either monitoring or providing distance learning out to those sites. So, if there's other questions you have in reference to something maybe a little different than that, please reach out to me.
Thank you so much, Roger. Our next question comes from Kay, who asked, would cabling in the school district to upgrade our system be eligible?
Yeah, if that would be necessary and there's other equipment coming along as part of that, say, for example, you're maybe updating a distance learning area or a particular lab or whatever within the school itself, and then the cabling necessary to make that happen would be eligible. If it's like more of a question to that, if we'd be recabling the entire school itself, probably not, unless that was like maybe to put in a Wi-Fi system throughout the school to where you're taking like a cart with may have the distance learning equipment on it, as well as the camera, the microphone, and the screen, so you could use that in multiple rooms. Maybe an example would be good for that, so you could use that in the entire school would be maybe the Wi-Fi system to go along with that. So that's kind of a yes and no answer. It more depends upon where the distance learning or telemedicine is being provided. And then if that room or that area does not have it, then that cabling would be eligible.
Perfect. Thank you so much, Roger. Are there any other questions that would like to be shared via the chat? We have a question from Suze, who is asking what if your end user is outside of Kansas?
You know, we have funded those type of applications, whereas they may have an end user site in another state. So it depends on what the situation is. But yes, we have done that, and that could be done as long as it was within, you know, the continental United States or Alaska, Hawaii, or one of those sites. But it gets to be more of an issue of just how to track that equipment, because the applicant would be eligible for the inventory of that. So that may be the only issue, but the answer to that is yes.
Thank you so much, Roger. We have another question from Jan, who asks, would this be available for advocacy for residents in nursing homes?
Yeah, I mean, if there's, you know, depending upon what the situation is, nursing home would be an eligible entity. And if there's either distance learning or telemedicine being provided as part of that application, then yes, that would be an eligible entity.
Thank you, Roger. Next up from Kay, we have a question. She said, could you partner with medical providers to provide telemedicine at school?
And the answer to that is absolutely yes. I mean, the question there is if you partner with them, who's going to be providing the telemedicine? Is the entity that provides the telemedicine going to be the applicant, or is the school going to be the applicant? Or it could be a consortium of the two. And if it's not a formal consortium, one of the entities would have to take the lead on behalf of the other. But probably the cleanest way to apply for that is having one of the entities, either the institutions that are providing the medical training or providing telemedicine to the school, or have the school apply for that purpose itself.
Thank you, Roger. Our next question comes from Sue, who asked, are private schools eligible?
And again, absolutely yes. Whether it's a private school and or a public school, there's no stipulation as long as it's a school. So, and they're provide distance learning in that case. So the answer is absolutely yes.
Thank you. Our next question comes from Dylan, who asked, could the telemedicine be used by emergency medical services to provide on-site care or patient follow-ups?
And yes, it depends on, you know, as long as it's being provided synchronously. And I don't, you know, maybe in the example, and I don't know the example that you're thinking about there in that case, but if it's, say, for example, someone goes to the emergency room and they may be from, wherever the community may be, 2 hours out, they're in town or whatever, they've been life flighted in and there's follow-ups, and they can do those, remotely from another location, wherever that may be. That definitely would be an eligible use.
Thank you. Next up, we have a question from Sandy. Sandy said, many insurance companies have suggested that the reimbursement for telemedicine will decrease once the pandemic is over, or whenever they decide to stop funding it at the same level as in person. Could these funds help supplement the telemedicine we are already providing for children with disabilities for therapies?
The answer is yes. The main thing is keep in mind that the distance learning and telemedicine program is more of a providing equipment type application. So, for those more hard assets, if it would be of an operational nature, then we could not provide any kind of ongoing support for that, because that would not be an eligible use. But if it would be to provide, additional equipment and ongoing equipment to continue to provide telemedicine as far as the equipment needs, then the answer is yes.
Thank you, Roger. We have another question from Dan about eligibility. Dan says, sounds like a portable distance learning cart with the necessary codecs, TV, etc., used for distance learning for public schools would qualify.
And if that's the question, the answer is yes.
Perfect. And Dan also wanted to know, what is the percentage and amount of funding we are looking at?
As far as the grant could be up to $1 million. There is a 15% match. So basically you're looking at 85% of it. If you want to look at a theoretical percentage, 85% of the application would be grant. The other 15% match, it's always preferred that it's in cash of a nature, supported by a support letter from the applicant to what the source is of that cash. We can be an in-kind in nature. The only thing, it has to be in the box like new equipment, and then that value would have to be supported by an invoice if it's in kind. So those are really the two acceptable matches. And then if you wanted to look at the grant percentage, it would be up to 85%. And then, of course, again, the match would be 15%.
Before we move on to the next question, I just had another quick question for Roger. As we're on the topic of match, I know a lot of different providers and instructors are receiving grants from other federal sources. And one of the questions that has been coming up is whether the match whether the funds from a different federal source can be used as match.
And unfortunately, if the match is coming from a federal source, it would not be eligible. If it came down as a federal source and went to an entity, say, for example, such as a state, and it lost its federal identity at that point in time and then was given back out to the applicant, then that would likely change the nature of those funds and it could be used at that point. But if it's coming directly from whoever that is, Commerce or whatever the source is, federally, then the federal funds could not be used for match, unfortunately, in that case.
Thank you.
Mm-hmm.
Thank you for that question, Jen. We have another question from Leah. Leah's question is, could a tribal government partner with a city government and a local teleco to provide broadband to residents of both governments who did not have internet or broadband to access remote learning at home during COVID?
Yeah, that's a great question. The distance learning telemedicine program is, set up for, then again, equipment and different programming to provide distance learning or telemedicine, and only 20% of it, along with that application, could be used to provide the conductivity to that building. The USDA has, the other programs, our infrastructure loan program, our Reconnect loan and grant program, as well as our Community Connect program to provide those type of needs that would be associated with municipalities providing with one of the tribal governments to provide that assistance. So that is definitely a question. If somebody has those needs, please contact me, and I'd be happy to visit with them about some of the other programs that the USDA offers to provide that assistance.
Perfect. Thank you, Roger. Mike just asked if you could explain the matching process once again, just to make sure that there's complete clarity amongst the group.
Yeah, there is a 15% match, and that's of whatever the grant amount is. So it would be, the total would end up being of the amount that you're applying for. 15% of that amount would be the match percentage. Again, that match could be in form of two things. The match could either be provided in the form of cash for that 15%, or the match could be provided in what they call in kind. And the general description that we use or the USDA uses for in kind would be, say, for example, if you had a new TV screen that was still in the box that you were going to use as part of the application, and you had a number of those, and they were, you could prove the value of those TVs that are still in the box new by an invoice, then that invoice amount, whatever it was, could be used for either in full part of the 15% or part of it. And then either it could be mixed with cash or whatever the situation may be. Like I said, it's always cleaner for the applicant to provide that 15% match in cash. And then again, that 15% cash would be used to fund 15% of your project. And then the USDA with the distance learning telemedicine program would come in with the balance or the 85% of that to complete funding on the entire application.
Thank you, Roger. So that is the last question that I see in the chat for now. I wanted to let you all know that we will be on the line for another 14 minutes if there are any other questions that we can answer. But thank you all for taking the time to come together today to discuss the USDA DLT program, putting up with some of our technical difficulties, and for being a part of helping bring these funds to the state of Kansas. We're very excited to be able to support you all through this process. So as you can see on your screen, please reach out to Roger, KDC Broadband at ks.gov, or Kansas COVID Support at ks.gov over the course of the coming weeks so that we can support you. We will be reaching out and sharing an abbreviated version of today's webinar, as well as materials over the course of the coming days.
Micah, thank you very much for your part in this, and everybody else on the line, Stan and Jen, everybody else is part. USDA really appreciates the state of Kansas being proactive on this. So thank you all very much, and it's very helpful, and it's really a good sign to see that you guys want to let more people know about the program and hopefully more people access it.
Absolutely, Roger. I know we haven't had a chance to meet since you took over the kind of role. Welcome aboard. I'm looking forward to working with you more as well. This is just a sign of more good things to come.
Yeah, thanks again, Stan, and